What if I told you that some veterinary treatments appear to work even when they probably don't? What am I talking about? No, the dogs aren't fooling themselves, but one of the biggest challenges in veterinary medicine is something called the caregiver placebo effect. And if you don't understand it, you can easily believe that a treatment works for your pet even when it doesn't. In people, the placebo effect happens because patients believe that they're receiving an effective treatment. Dogs and cats don't know what medication they're taking, but the pet owners do. And when pet owners expect improvement, they may honestly perceive a positive change in their pet's behavior, their mobility, or their comfort, even if the treatment itself has no real biological effect. They're not imagining it, they're seeing what they genuinely believe they're seeing. One of the best examples of this is in canine osteoarthritis research. This has been demonstrated repeatedly in studies. Across multiple randomized placebo-controlled clinical trials, 20 to 60% of dogs receiving the placebo are reported by their owners to improve. That's an enormous number. But when the researchers use objective measurements like force plate analysis, which measures exactly how much weight a dog will put on a painful limb, the improvements are often much smaller or disappear entirely. That's why objective data matter. This same phenomenon shows up even in the modern arthritis drug studies. In the pivotal Galliprant trials, many of the placebo-treated dogs were reported by their owners to significantly improve. Now, the drug still outperformed the placebo, but the placebo response itself was substantial. My favorite example of this is the seizure studies. Researchers reviewed placebo-controlled epilepsy trials and found something remarkable. 79% of dogs receiving the placebo had fewer seizures than they did before entering the study. Even more surprising is nearly 1/3 of placebo-treated dogs experienced at least a 50% reduction in the seizure frequency, a response that many people would consider a successful outcome. Now, did the placebo stop the seizures? Almost certainly not. Epilepsy naturally waxes and wanes, and often owners will enroll their dogs during a particularly bad stretch, and over time, seizure frequency may decrease simply because the disease fluctuates. That's called regression to the mean, and when you combine it with the caregiver placebo effect, ineffective treatments can appear incredibly convincing. And you know what? Cats are no exception to this. Cats present the same challenge. Pain is subtle. Cats hide discomfort exceptionally well. So when owners desperately want to see improvement, caregiver placebo effect can be substantial in studies evaluating feline chronic pain and osteoarthritis. Now, this doesn't mean that pet owners are wrong, and it doesn't mean that veterinarians are easily fooled. It means that human perception is incredibly powerful, and that's exactly why veterinary medicine depends on randomized, blinded, placebo-controlled clinical trials. Because without them, we'd end up recommending treatments simply because they seem to work, not because they actually do. So the next time somebody says, I gave my dog this supplement and his arthritis disappeared, or his seizures improved after I started this new product, remember, maybe it worked, but maybe the disease naturally improved. Maybe expectations change what the owner noticed. That's why anecdotes are where science begins, not where it ends. Evidence-based medicine isn't about whether something appears to work once. It's about proving that it works better than a placebo when nobody knows who's receiving the real treatment. That's why good clinical trials matter. Follow me for more evidence-based veterinary medicine.